Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. Doctor's order, heparin 4,390 units sub-Q bid. Available, heparin 5,000 USP units per ml in 10 ml. How many ml will you administer? A.8. 8 milliliters, B.0. 88 milliliters, C.A. 88 milliliters, D. 0.18 milliliters. The answer is option A. 8.8 milliliters. 2. A 45-year-old construction engineer is brought to the hospital unconscious after falling from a 2-story building. When assessing the client, the nurse would be most concerned if the assessment revealed A. Reactive pupils, B. A depressed fontanelle, C. Bleeding from ears, D. An elevated temperature. The answer is option C. Bleeding from ears. 3. The nurse is aware that the most relevant knowledge about oxygen administration to a male client with COPD is A. Oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing. B. Hypoxia stimulates the central chemoreceptors in the medulla that makes the client breath. C. Oxygen is administered best using a non-rebreathing mask. D. Blood gases are monitored using a pulse oximeter. The answer is option A. Oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing. 4. Point with burn injury. After 48 hours, the physician orders 2 liters of 4 fluid to be administered every 12 h. The drop factor of the tubing is 10 gtts/milliliter. The nurse should set the flow to provide A. 18 gtts/min, B. 28 gtts/min, C. 32 gdt/min, D. 36 gdt/min. The answer is option B. 28 gtts/min. 5. A 21-year-old man was diagnosed with type I diabetes. The nurse is aware that acute hypoglycemia also can develop in the client who is diagnosed with liver disease, B. Hypertension, C. Type 2 diabetes, D. Hyperthyroidism. The answer is option C. Type 2 diabetes. 6. Some defects occurred in nursing care and nurse manager was observed. There is low results of patients' care outcomes. Which of the following is the first step for nurse manager? Schedule meeting with staff, B. Start changes to improve, C. Change staff, D. Report to director. The answer is option schedule meeting with staff. 7. Point has undergone kidney transplant. What assessment would prompt the nurse to suspect organ rejection? A. Sudden weight loss, B. Polyuria, C. Hypertension, D. Shock. The answer is option C. Hypertension. 8. A client is scheduled for a percutaneous transluminal coronary angioplasty. The nurse knows that a PTCA is the surgical repair of a diseased coronary artery, B. placement of an automatic internal cardiac defibrillator, C. procedure that compresses plaque against the wall of the diseased coronary artery to improve blood flow, D. non-invasive radiographic examination of the heart. The answer is option C, procedure that compresses plaque against the wall of the diseased coronary artery to impro. 9. The nurse is teaching a mother whose daughter has iron deficiency anemia. The nurse determines the parent understood the dietary modifications if she selects A. bread and coffee, B. fish and pork meat, C. cookies and milk, D. oranges and green leafy vegetables. The answer is option D, oranges and green leafy vegetables. 10. The rationale for having the patient void before an abdominal paracentesis procedure is to A. minimize discomfort, B. avoid abdominal distension, C. prevent bladder puncture, D. reduce infection rate. The answer is option C, prevent bladder puncture. 11. A patient is diagnosed with diabetic ketoacidosis. The nurse would expect the physician to prescribe regular insulin for B. NPH insulin SC, C. glucagon IM, D. mixed insulin SC. The answer is option A, regular insulin for. 12. The client presented with complaints of body weakness, dizziness, and chest pain. Upon careful assessment, the nurse suspects angina pectoris. Which of the following statements made by the client can confirm this? A. I suddenly felt a pain on my chest which radiates to my back and arms. B. I suddenly felt a sharp pain on my lower abdomen. C. The pain does not subside even if I rest. D. The pain goes all the way down to my stomach. The answer is option A. I suddenly felt a pain on my. 13. The client from the OR is transferred to the post-anesthesia care unit after surgical repair of abdominal aortic aneurysm. Which of the following assessment findings would indicate that the repair was successful? A. Urine output of 50 milliliters per hour. B. Presence of non-pitting, peripheral edema. C. Clear scara. D. Presence of carotid bruit. The answer is option, urine output of 50 milliliters per hour. 14. The client is scheduled for cardiac catheterization because the physician wants to view the right side of the heart. Which of the following would the nurse expect to see in this procedure? A. ADI is injected to facilitate the viewing of the heart. B. Thallium is injected to facilitate the scintillation camera. C. A probe with a transducer tip is swallowed by the client. D. Otomy ultrasound probe is inserted into the coronary artery. The answer is option A. ADI is injected to facilitate the 6. 15. The nurse would increase the comfort of the patient with appendicitis by having the patient lie prone, B. flexing the patient's right knee, C. sitting the patient upright in a chair, D. turning the patient onto his or her left side. The answer is option B, flexing the patient's right knee. 16. The client's ECG tracing shows ventricular tachycardia secondary to low magnesium level. Which of the following electrocardiogram tracing results is consistent with this finding? A. The appearance of a U wave. B. Shortened ST segment and a widened T wave. C. Tall, peak T waves. D. Tall T waves and depressed ST segment. The answer is option B, shortened ST segment and a widened T wave. 17. A home care nurse visits a patient who is discharged from a hospital after a treatment of urosepsis. Which of the following post-discharge normal laboratory result best indicates desired outcome? A. WBC count. B. Hematocrit. C. Platelet level. D. Potassium level. The answer is option A, WBC count. 18. Cancer surgery is an example of what operation type basing on the time it is required to be performed? A. Optional surgery. B. Imperative surgery. C. Emergency surgery. D. Elective surgery. The answer is option B, imperative surgery. 19. Treating pregnant women diagnosed with syphilis is considered A. Primary level of prevention. B. Secondary level of prevention. C. Tertiary level of prevention. D. Primary and secondary. The answer is option B, secondary level of prevention. 20. What do we call the type of treatment of terminal illness patients? A. Conservative. B. Curative. C. Palliative. D. Selective. The answer is option C, palliative. 21. The nurse is suctioning a client via an endotracheal tube. During the suctioning procedure, the nurse notes on the monitor that the heart rate is decreasing. Which nursing intervention is most appropriate? A. Continue to suction. B. Notify the healthcare provider immediately. C. Stop the procedure and reoxygenate the client. D. Ensure that the suction is limited to 15 seconds. The answer is option C, stop the procedure and reoxygenate the client. 22. The nurse is caring for a client after a bronchoscopy and biopsy. Which finding, if noted in the client, should be reported immediately to the healthcare provider? A. Dry cough. B. Hematuria. C. Bronchospasm. D. Bloodstreak sputum. The answer is option C, bronchospasm. 23. The nurse instructs a client to use the pursed lip method of breathing and the client asks the nurse about the purpose of this type of breathing. The nurse responds, knowing that the primary purpose of pursed lip breathing is to promote which outcome? A. Promote oxygen intake. B. Strengthen the diaphragm. C. Strengthen the intercostal muscles. D. Promote carbon dioxide elimination. The answer is option D, promote carbon dioxide elimination. 24. Patient came with breast cancer. the treating doctor give her a prognosis that she is really sick and she might die after 6 months, the patient depressed and she start to have a relation with the staff nurse. What kind of this relationship? A. Terminal relation. B. Work relation. C. Palliative relationship. D. Grief. The answer is option C, palliative relationship. 25. A nurse is going to administer ear drops to a 4-year-old child. What is the correct way of instilling the medicine after tilting the patient's head sidewards? A. Pull the pinna back then downwards. B. Pull the pinna back then upwards. C. Pull the pinna up then backwards. D. Pull the pinna down then backwards. The answer is option C, pull the pinna up then backwards. 26. A pregnant woman is admitted for preeclampsia. The nurse would include in the health teaching that magnesium will be part of the medical management to accomplish the following: A. Control seizures. B. Promote renal perfusion. C. To decrease sustained contractions. D. Maintain intrauterine homeostasis. The answer is option A, control seizures. 27. When the nurse checking rectal temperature for infant, how depth thermometer should be inserted? A. 2 cm. B. 2.5 cm. C. 3 cm. D. 3.5 cm. The answer is option B, 2.5 centimeters. 28. Mother of child asking the nurse for the perfect time for cleft lip and platelet surgery. When the child learns to drink from a cup. B. When the child weight is 15 IB. C. From 2 to 6 months of age. D. From 6 to 12 months of age. The answer is option C, from 2 to 6 months of age. 29. What should a nurse do prior to taking the patient's history? A. Offer the patient a glass of water. B. Establish rapport. C. Ask the patient to disrobe and put on gown. D. Ask pertinent information for insurance purposes. The answer is option B, establish rapport. 30. A nurse is preparing to give an IM injection of iron dextran that is irritating to the subcutaneous tissue. To prevent irritation to the tissue, what is the best action to be taken? A. Apply ice over the injection site. B. Administer drug at a 45-degree angle. C. Use a 24-gauge needle. D. Use the Z-track technique. The answer is option D, use the Z-track technique. 31. An appropriate instruction to be included in the discharge teaching of a patient following a spinal fusion is: A. Don't use the stairs. B. Don't bend at the waist. C. Don't walk for long hours. D. Swimming should be avoided. The answer is option B, don't bend at the waist. 32. The nurse taking an apical pulse would place the stethoscope at the left of the sternum at the third intercostal space. B. Directly below the sternum. C. Slightly above the left nipple. D. The left midclavicular line at the fifth intercostal space. The answer is option D, the left midclavicular line at the fifth intercostal space. 33. A patient has been admitted with hypothermia after lying unconscious overnight in an unheated apartment. The most appropriate route to assess the patient's core temperature would be A. Rectal, B. Tympanic arterial thermometer, C. Axillary, D. Tympanic. The answer is option C, axillary. 34. An 18-month-old baby appears to have a rounded belly, bow legs, and slightly large head. The nurse concludes, A. The child appears to be a normal toddler, B. The child is developmentally delayed, C. The child is malnourished, D. The child's large head may have neurological problems. The answer is option C. The child is malnourished. 35. He nurse plans to frequently assess a post-thyroidectomy patient for A. Polyuria, B. Hypoactive deep tendon reflex, C. Hypertension, D. Laryngospasm. The answer is option D, laryngospasm.
Thank you for watching.